Hello everyone, Teresa Abolish here, live in sunny South Australia. I'm in Burra, which is a lovely little town in South Australia. So many beautiful, wonderful towns in Australia that I've travelled to and in the past as well, and I'm going all the way around after Burra, going to Peterborough, then Perth, Broome, Darwin, Alice Springs, back to Peterborough, and then Melbourne. Yeah, so it's just a brilliant tour. I've been going over a month and to promote my brilliant book, Political Persecution of Women and Children, 556 pages. And I haven't checked my email for about 3 days, so if you've ordered the book, it's $39 plus postage, which is a bargain, because if you get a book like this in a university, it costs you about $150. I haven't checked my email, so if you've ordered the book, I'm getting to you, and you can just email me to get the book, and it's teresalegend@hotmail.com, and also in Australia you can call me on the telephone, text me or call me. My telephone is still very public for over 10 years because I love to talk to people in person or on the phone especially. So what I'm going to talk about today, just quickly, there's the also the public campaign that I'm doing for the next 8 months for Australians to vote for the Governor-General job from a list of candidates, being the federal election 2025, where the Australian people should be voting for that position, which they should have had that way from the beginning in the Constitution. But because the politicians are very selfish and greedy and corrupt and evil and criminal, they don't give a rat's ass about the population, do they? So they just do what they want. Today I'm going to talk about Chapter 6 in my book, which is the pretty much the political horrors of gender ideology in Australia and globally. Before I do that, I just want to show you this lovely canvas I have here. Next week is Easter, and I'll be doing an Easter speech as well. Just wanted to show you this little canvas that I have, and I have other canvases like this from the Bible. This is where God parted the Red Sea for the Moses and the Israelites to go through the Red Sea, and such a beautiful canvas, which I'm going to put up in my home, or my bus, my travelling motorhome and bus. And just wanted to show you that lovely little canvas that I have. And also, every speech that I give, I want to talk a little bit about the economy, because I think it's very important to keep talking about the economy, and it's very, very important because the economy, what sort of economy we have affects everybody, doesn't it? It affects everybody in so many ways. What sort of economy the politicians create and have. And we know there's lots of problems with that, what they've been doing, trying to create a cashless society and all that sort of thing. In my speech in Mildura, I talked a lot about the economy, my economic vision, and go back and watch that. But, you know, Facebook, when you do a live video, they take that video off every 30 days. So I have to keep putting my speeches back up, which I'm going to do for the next 8 to 10 months. So also watch the speech I made in Mildura about the economy. Just quickly, what I want to say about the economy before I talk about Chapter 6 of my book, my brilliant book, is the foreign debt Australia has, and that's been created by those corrupt politicians, Labor and Liberal and the Greens and the Nationals. They're the 4 parties that really deserve to be banned and probably thrown in prison, you know, which should have happened 10 years ago before they could bring all these horrific laws in that they bring in. So with the public debt, or the government debt that the Commonwealth has, Australia, September 2023, it was $1.17 trillion. Do you know that, the foreign debt? And now it's $1.24 trillion as of March 2024. That's an increase of 7% of foreign debt that the Australian politicians have created. And my solution is, you know, as I said, the people need to vote for the Governor-General's job, and if I had that job, say under God Almighty and by the will of the people, how do you solve that foreign debt issue? Well, you know, because it's done under corrupt politicians, we just say, well, we're going to cancel that debt, and we're not giving 1 cent to foreign banks anymore, these international banks who make billions and billions of dollars every year, don't they? The disgusting profiting of the banks that the politicians allow is so criminal and evil and disgusting, multi-billion-dollar profits, and they're really to blame for a lot of things that go on, poverty, for example, homelessness. So we should just say as a nation, okay, we're not going to pay that debt, that's it. We're going to cancel it to zero by not giving you any more money and not allowing any more money to leave Australia. So that has to stop, giving billions of dollars to the foreign banks and international banks and the International Monetary Fund and all these corrupt organisations. We won't hand over 1 more cent under my leadership. And, you know, I'll hand over the politicians before I hand over even a dollar to the foreign international banks. And that's how you cancel a debt of any nation, because that debt is created under corrupt politicians. If they're so bad with the economy and corrupt and evil and stupid, to allow that sort of debt to go on and on and on, it's going up and up. As I said, $1.24 trillion as of March 2024. So cancel the debt by saying, well, that's it, talk to the hand. No more money's going to those foreign banks, those international banks, and no more money going to the International Monetary Fund. Because it's done under corrupt politicians, and we'd rather hand over the politicians than the money and all the billions that they're sending to foreign companies for their wars and all this sort of thing. It has to stop. That money needs to be stayed in our nation to build homes, 1 million homes for the Australian people, Australian citizens, the homeless people, and that money needs to be used to build, create jobs and help the small business people and all that. We shouldn't be giving any money to foreign banks, foreign companies, foreign countries, because that money is supposed to be for our people. And that needs to stop. They should have stopped a long, long time ago. Okay, I've said my bit about the economy. I'm going to give something about the economy before every speech, and I've decided. So today's chapter 6. Chapter 6 of my excellent book. It's got 12 chapters, and chapter 6 is the largest chapter. You know, it's the largest chapter. Chapter 6, gender ideology, transgenderism, politically legislated and funded eugenics depopulation program world. And it's 185 pages. Before to begin with, to talk about this topic, gender ideology, forced on the population, I'll talk just briefly about the recent law brought in Victoria by the state politicians, the Labor and Greens politicians in Victoria. They're just scumbags and parasites and reprobates, really. I mean, they're just toxic politicians, aren't they? They should have been jailed and banned 10 years ago before they could put these horrific things in the law. And what they did, they brought in this hate speech law just recently. And what they've said, it's not really a hate speech law. What it actually is, it should have been called a destroy free speech law. That's what they really did. They put in a law, a destroy freedom of speech law, which is what it is, and that's what they should be calling it. They should be honest and call it that, because what they want to do with any hate speech law that they create anywhere in the world, not just Australia, anywhere in the world, they want to destroy free speech. They want to destroy free speech and do all these horrific things to the population, to women, parents and children, and then censor you, the population, from talking about it. Now, they can get fucked. I'm talking in South Australia at the moment, so those state laws don't apply. However, I covered all this in my book already, which was published in July 2024. These politicians are reprobates. They should be in jail. It's so disgusting and evil and horrible what they've done with this hate speech law. And they say, a whole list of group of people, you can't criticise anybody, any group of people or any issue or any topic without them wanting to put you in prison for 5 years in Victoria. So that recent state law that they brought in Victoria. 5 years imprisonment, up to 5 years imprisonment. If you publicly talk about, or what they call vilify, any sort of groups, particular groups, on the basis of religion or, gender identity, even another disability and all these different issues. Now, they just want to destroy free speech. So we have to remember that the biggest haters in Australia are the politicians. They hate us. They hate everybody. They do horrible, violent, criminal things to the population, and they hate us so much they don't want us to talk about anything. Okay? So they think that the political law, they can just make a law and then throw you in prison for 5 years, up to 5 years for free speech. They are tyrants of the worst kind doing that. Any sort of decent leader or good politician or decent leader will never, ever censor the population like that with horrible laws where they want to throw you in prison up to 5 years for free speech. I mean, how outrageous is that? How outrageous. And who is voting for these criminals in our parliaments, state parliaments, federal parliaments? Who is voting for these criminals? They should have been jailed 10 years ago, their parties banned 10 years ago, before they could do all these horrific things to children and women and parents and good men in society. It's just absolutely disgusting. This topic here, gender ideology, I want to make it absolutely clear. When I criticise, I already published this last year, but when I criticise, I'm criticising the politicians that make the laws about it. And everyone in society, I'm not really criticising them in a sense that, if they want to destroy free speech, sure, I'll criticise them. I don't blame them, really. I see them as victims of these politicians who put this rubbish and garbage in the law. And the way they use public money and government workers and all these doctors, gender doctors that they're criminalising, because, 35 gender doctors in Australia that I wrote about in my book, I named them all publicly because it's all public information. So they published all that. They're like Dr. Mengele, and they're spending billions on this rubbish. It's absolutely disgusting. Anyway, what I'm going to do, I've made some notes, and I'm going to read sections of chapter 6 to you of what I've already published. And, just to any politicians who may watch this, don't do a job like that if you're going to basically, destroy people's rights to free speech, because you're nothing but a tyrant and a criminal doing that. So be careful, because there is a judgment from God and Jesus, and you'll probably find yourself going to hell for doing this to entire nations, to the entire population, not just Australia, but Europe, United States, South America, North America, Asia, Africa, every nation, every continent on earth. So chapter 6, what are called gender ideology, transgenderism, politically legislative eugenics, depopulation program. Now, eugenics, I left about chapter 5, when published this, it's a depopulation program. And eugenics is the promotion of people that, usually the powerful people, they just want to promote, to breed certain kinds of people, healthy people, people they consider healthy and good breeders, like Hitler used eugenics. And they also want to eliminate people who they deem undesirable or burden society and all that. That's basically the eugenics, that certain types of people have a right to live and certain types of people don't have a right to live and they get wiped out. So some of that thinking comes through in this gender ideology thinking. I'm going to go through some of the history of it and all different factors, so the surgeries, the self-ID, the impact on women and children and parents and men as well, and it just impacts everybody, and how they force it in the schools and the clinics and the health system, and just wasting billions really as well. So I'll just read extracts from my book, different issues and factors related to this whole topic. Gender ideology and transgenderism is politically legislated and funded eugenics, depopulation worldwide. It's also a component of the LGBTQI plus agenda to increase the sexualization of children and adults, pedophilia, and promote bestiality. It's also incredibly destructive to women and children. It's currently the misogynistic tip of the spear of men's violence towards women for thousands of years worldwide. There are also millions, billions of women and men against it. It's also destructive to parental rights. A lady on YouTube, Dark Verona, aptly commented, "I've been saying the patriarchy has put on a dress and now women must bow down to it." From 2011, the genderqueer pride flag stole the women's 1908 suffragette flag. What men are doing is coveting and stealing everything women have. They can't have it. It's more dominion, domination, slavery, oppression, violence. Very nasty. Another woman on YouTube, Gazelle Maghreb Hay, said, Trans ideology is the love child between big pervert and big pharma. Sounds about right. Transgenderism, transgender ideology, gender identity ideology has today become an evil monster, politically legislated, funded, promoted by both men and women, politicians, psychiatrists, psychologists, sexologists, doctors, nurses, counsellors, teachers, schools, parents, corporations, universities, media people, activists, drag queens, rich globalists, globalist organisations like the UN, the WHO, the WEF, the World Professional Association of Transgender Health, the WPATH. It's like a death cult. Transgenderism also has an impact on the development of transhumanism and artificial intelligence, AI. Juxtaposed, there are also millions, billions of professionals, parents, organisations, media, leaders and other people against it. I will say, as with most evil, half the world's population are for it and half are against it. To be blunt, if the world genital mutilates and sterilises children and adults with puberty blockers, cross-sex hormone surgeries, that's eugenics. It's depopulation. Some doctors call gender drugs sex steroids and castration. Logically, when you do that, you don't want humans to naturally have children, to procreate, to be heterosexual. You're going to reduce the population. Also, the grooming and sexualization of children in today's world, in schools and societies, is an abomination. People are not talking enough about the criminality of what adults are doing, particularly to children. It's massive child abuse. It's celebrated child abuse. It's child sexual abuse. It's a crime against humanity. Gender ideology is a biological lie. Falsely claiming a boy can be a girl can be a boy, a man can be a woman can be a man. This lie is impossible to achieve, given every DNA cell in the human body ensures the sex chromosomes and characteristics of humans, male XY or female, male XY or female XX, from conception through life to death. What results from this lie is the potential genital mutilation and sterilisation of humans, including children, and much more destruction in society. Again, we see Voltaire's views that absurdities can make people commit atrocities, apparent in the practical consequences of this ideology. And I refer briefly to the back of my book, the quotes on the back of my book. And I'm going to read those out now. A writer's job is to rub up against the grain of conventional thinking and to make people think about things in different ways, sometimes in ways that make them feel uncomfortable or even offend them. That's Lee Sales, ABC, 2018. Our deepest fear is not that we are inadequate. Our deepest fear is that we are powerful beyond measure. It is our light, not our darkness, that most frightens us. We ask ourselves, who am I to be brilliant, gorgeous, talented, fabulous? Actually, who are you not to be? Marianne Williamson, 1992. The party told you to reject the evidence of your eyes and ears. It was their final, most essential command. If all others accepted the lie which the party imposed, if all told the same tale, then the lie passed into history and became truth. Who controls the past controls the future. Who controls the present controls the past. People will believe what the media tell tell them to believe. George Orwell, 1949. Those who make you believe absurdities can make you commit atrocities. Voltaire, 1765. In the time of universal deceit, telling the truth is a revolutionary act. 1912, Charles Spence, Antonio Gramsci, 1919. The further a society drifts from the truth, the more they will hate those who speak it. Author unknown, but I think I actually found the author there. Some people said that's from George Orwell's book 1984. But actually it's not if you look at that, it's not in there. First you don't succeed, try and try again. Robert the Bruce, 1314. Only men could oppress women for thousands of years, then turn around, put on a dress and complain they are the most marginalised group in society. Kara Dansky, 2020, she's in the United States. The oppressor would not be so strong if he did not have accomplices amongst the oppressed. Simone de Beauvoir, 1947. As long as we have involuntary mental hospitalisation, psychiatry is a prison work. It's a crime against humanity. It's not medicine. Involuntary hospitalisation is like slavery. The problem is not how to improve commitment, but how to abolish it. Dr. Thomas Sowse, USA professor and author of psychiatry. The oppressed and the oppressor alike are robbed of their humanity. When I walked out of prison, that was my mission, to liberate the oppressed and the oppressor both. Nelson Mandela, 1994. Treat people the way you want to be treated. Love others as you love yourself. Jesus Christ, Luke chapter 6 verse 31 and Matthew chapter 22 verse 39. So Voltaire there, again we see Voltaire's view that absurdities can make people commit atrocities, apparent in the practical consequences of this ideology. A man in a video on the internet explains, well, if you put 100 women and 10 men on a deserted island, in 100 years, you'll have a thriving community of men, women, boys and girls. But if you put 100 trans women and 10 men on a deserted island, in 100 years you will find skeletons of 110 men. I put the source there for a lot of these, my evidence. Gender ideology is eugenics, depopulation, among other things. I think gender trans ideology is very self-destructive for every nation. If everyone was transgender in any nation, an enemy army could walk in and take over. It makes any nation much weaker because it's physically unhealthy. How absurd to make people physically unhealthy. A strong, physically healthy nation makes the nation strong and prosperous in many ways. Just as psychiatry did, proponents of gender ideology and transgenderism from the start corrupted and manipulated language to promote their evil agenda. Originally, the word gender is defined in an Oxford Etymological Dictionary of the English Language of 1882 as kind, breed, sex. So originally the word gender was accurately defined as sex. From the 1940s, the word gender was corrupted to try to falsely claim gender is a social construct. That can be changed from biological genetics. 4 central men are involved in developing, creating and influencing the W path. Alfred Kinsey was an an insect specialist who created the Kinsey Institute in 1947. John Money, an American psychologist, a sexologist, corrupted the word gender to create the term gender role in 1955. Some researchers claim Money invented the term gender identity, however he didn't. The term or label gender identity was subjectively invented by USA psychiatrist Robert J. Stoller in 1964. We know psychiatrists subjectively invent their labels outside of biological evidence, objective medical assessment, testing and assessment. John Money founded the Gender Identity Clinic at Johns Hopkins University in 1966. Endocrinologist and sexologist Harry Benjamin subjectively invented the term gender dysphoria syndrome in 1973. A few women have had an impact on gender theory, more notably Judith Butler, Kate Bornstein. According to USA pediatric endocrinologist Professor Dr. Quentin Van Meter, Money, Kinsey and Benjamin were vile perverts who had sex with and also promoted adult sex acceptance with children. The Harry Benjamin Society was created in the early 1970s. It later became the World Professional Association of Transgender Health, WPATH, in 1979. The subjective label gender identity disorder was added to the psychiatric DSM-3 in 1980. In 2013, the psychiatric DSM-5 changed gender identity disorder to gender dysphoria. So most of the early proponents of transgenderism corrupted the word gender and associated gender terms to later sterilize and mutilate the genitals of the human body and were vile sexual perverts. I'm just going to go to this point now, just quickly, a quote, which I've got to give you about, hang on a minute, the actual... the concept of gender dysphoria was also fake and made up by a psychiatrist, so it's fake. Hang on a minute, I've got to find it. And it's basically, these words are subjective labels. They're just made up words. They're just rubbish words. Words made up or words, language corrupted. And this is how they corrupt language to create, physical violence towards people. To mutilate the human body is physical violence. It's assault. And they do perverted things, Here we go, found it. Gender dysphoria is a subjectively made up fraudulent concept forced by adults on children and other adults. Gender identity syndrome was made up by USA psychiatrist Norman M. Fisk in 1974. See, no one else is talking about this. So we know it's fake rubbish. It was renamed gender identity disorder and included in the psychiatric DSM-3 in 1980. Again, renamed gender dysphoria in the 2013 psychiatric DSM-5. Fisk, this is Norman M. Fisk, 1974 psychiatrist who made up these fake labels. Fisk was obsessed with Harry Benjamin and his gender colleagues' work. Fisk admitted the greatest source of gender dysphoria was strict social norms regarding how women and men should behave, not the body itself. The ICD-11 labels gender dysphoria as gender incongruence. University of Oslo Centre for Gender Research, Gender Dysphoria 2019, stk.uio.no. So it's a lie, a scam. They're physically mutilating people for it. Voltaire's warnings, absurdities, committing atrocities. So I'm just going to go back to that bit where I was reading. Hang on a minute, I'm just going to go back, sorry. Let's just go back. Because I brought that up later because it was related to something I was talking about later. Okay, so we're talking about Professor Quentin Van Meter, who is a United States pediatrician, top pediatrician. Professor Quentin Van Meter is a board director and former president of the American College of Pediatricians. His Sydney talk video, 17th of August 2018. My background in transgender medicine goes, this is quote, Dr. Van Meter, quoting him, My background in transgender medicine goes all the way back to my fellowship years. At the time I was in my fellowship training, we had what I refer to as the Three Musketeers. Alfred Kinsey, who was in Indiana at the Kinsey Institute. He was an entomologist who started the institute in 1947. Not a physician, not a psychologist, but an entomologist. So he knew a lot about insects. That's his background. John Money, who was a psychologist, joined the Johns Hopkins faculty in 1951. He trained as a clinical psychologist at Harvard, a reputable educational institution, but he also hung around Johns Hopkins because Johns Hopkins was the epicenter at the time of children with, quote, disorders of sexual differentiation. That is where their anatomical parts did not match their biological sex, or they were a mix between, so-called disorders of sexual differentiation. Also unfolding the concept of how the sexes physically differentiate during fetal life. This institution essentially laid out the pathways that hormones created these effects in utero, and the patients then came to be born sometimes with a mixed up. It's a very rare concept. So these patients came to Hopkins for evaluation to figure out what may have happened to cause that. Probably just a natural biological defect. And then that's my words, not Dr. Van Meter. And then subsequently to design some kind of interventional therapy to bring them back into as much function as deemed possible at the time. So Money used this group of children to essentially be a fertile playground for experimentation. He developed what was called the psycho-hormone group at Johns Hopkins Hospital. He followed the pre-eminent pediatric endocrinologist in the country at the time, Dr. Lawson Wilkins. Followed him around his clinics, and after a year, John Money, PhD, declared himself a pediatric endocrinologist. Those were his own words in his biographic statement. Harry Benjamin, the third of the trio, was a general medical practitioner in New York City. He spent summers in San Francisco. He had no training at all in psychiatry. These three individuals knew each other well. They were all somewhat deviant in terms of their worldview and behaviours, and I can say that because I personally knew John Money and had exposure to his philosophies as he taught us his view of life, and that included sexual interaction with children. In the case of John Money, and certainly it's documented that Alfred Kinsey did the same thing, having sexual encounters with young children, boys in particular. None of this is an accusation that can't be matched. It's all archived in records. That's what Dr. Van Meter says. So these three folks got together and kind of hobnobbed with each other and decided they wanted to change the landscape of human sexuality across the country. So John Money introduced the term gender as a psychological concept. Previously to the 1960s, it pertained strictly to language. Words were either masculine or feminine in a number of languages, in German and French, for the masculine and feminine. So John Money made a decision that gender applied to human beings, and the term gender identified the internal self-sex as male and female. So it was a concept that he put forth that had no scientific basis. He just believed it, and he proceeded with his experimentation on patients to try to prove that as false or true. Money was intrigued by the study of patients with sexual differentiation, then called hermaphrodites or pseudo-hermaphrodites. Money joined the faculty and established protocols, interviewed all pediatric patients who had abnormal sexual anatomy or who had early sexual maturation. Money's adult transsexual program was an outcropping of that experience. It's what he really wanted to do at the end of the day. He took in adult patients who believed they were born in the wrong body, quote. They were recruited across the country. We had no internet back in that day. So this was a relatively small group of individuals. Very, very rare, Dr. Van Meter says. His protocol indicated his patients had cross-dressed for 2 years, no hormonal manipulation. They just had to live in their new identity. At the end of the second year, if they persisted and were employed, and they maintained their savings account of $2,000 to cover any eventual cost, at least in a symbolic way, they were treated with cross-sex hormones. Estrogen and testosterone were widely available at very low cost at that point in time. Their surgical procedures were developed by the urology and gynecology departments at Johns Hopkins and applied to adults first to remove external genital genitalia and create new structures that have previously not existed. These were then applied to infants and young children who had these disorders of sexual differentiation. So these infants and children were either males who were under-virilized. The testosterone they were producing was either not produced or the patient was resistant to it, and in the uterine environment, the genitalia did not fully develop, because becoming an anatomical male is a very active process. It's not at all passive. You have to work very hard to have the hormone, the receptor, and the tissue response to create all the male genital structures which are part of the human body. So these, quote, disorders happened in the children, and the surgical procedures were applied to them to remove ambiguous parts, and in John Money's scientific protocols, the child was changed from their biological sex to match what he thought would be the best outcome for them. Money's so-called scientific protocols were, I have an idea, let's do this and see how things work out. So a very scary concept, said Dr. Van Meter. Okay, I've got so much information in this chapter, but I'm going to read it all out, obviously. I'll go through some statistics about prevalence and other research data, worldpopulationreview.com, global statistics, and by continent and continent, how many people identify as transgender. So, lots of statistics there. And then this little bit here, I was just reading out excerpts. I put a blue note sticky. Transgender gender surgeries are horrific. They're very gruesome. As previously stated, the people driving this erroneously call it gender-affirming care, when the reality is more like gender-affirming mutilation or gender-affirming butchery. How people corrupt and manipulate language to do evil acts is astounding. Imagine the self-loathing, self-hatred required to cut off your breasts and other genital mutilation surgeries. I call it Dr. Mengele type surgeries, Frankenstein stuff, when doctors, psychiatrists, psychologists and surgeons today are injecting and giving oral drugs, puberty blockers and cross-sex hormones, physically mutilating and removing or amputating genitals, skin flaps, or adding on fake genitals to the human body on healthy humans. Joseph Mengele was a German Nazi SS physician who conducted vile sadistic experiments on children, twins, dwarfs, pregnant women, disabled people, killing all of his victims at Auschwitz-Birkenau, Romani concentration camps. Mengele amputated healthy limbs, injected diseases such as typhus, blood transfusions, injected chloroform into hearts, sewed twins together, injected chemicals into eyes, removed eyes, teeth and blood, drug and lethal injections, x-rays to sterilize, removed hearts, stomachs, kidneys without anesthesia, conducted selections, beatings, shootings, gassings. He also kept body parts for experimentation. They called him the Angel of Death. What is the difference between what Dr. Mengele did and what is medically done today under gender trans ideology? Question mark. The law, government policies, funding, government workers were used by the Nazis to do it, as do politicians today with gender surgeries, drugs and indoctrination. Consent is the difference. Consent is the difference for adults, yet children can't consent. So adults involved are committing crimes against humanity. And at least half the world's adults are not consenting for politicians and society to do these surgeries and drugs. Clearly, gender drugs and surgeries are not natural or normal. It's a biological perversion so profound it defies belief that adults can do this, especially to children and also to other adults. Some people claim gender dysphoria, genital mutilating or sterilizing the human body is a mental illness. Yet, as I've already proven, there's no such thing as mental illness. That's in Chapter 5. It's 100% subjective labels. What it is evil thoughts in the brain and heart, massive lies, a delusion that humans can change their biological sex when no human physically can. And acting on those lies to physically mutilate, amputate, castrate, sterilize the body with puberty blockers, cross-sex hormone surgeries is assault and torture. It's violence. Isn't it at the very least self-harm? Don't doctors take an oath to do no harm, the Hippocratic Oath? If a person has thoughts or feelings they want to cut off their breasts or penis, that is self-harm. To act on that or affirm that is absurd and irresponsible. Shouldn't the logical response be, no, you can't do that? If a person says, I want to kill myself, we as a society don't say, okay, off you go, do that. We don't do that as a society, do we? It's criminal what these so-called doctors are doing. It has to be outlawed worldwide. Such people need lots of good, compassionate counselling, teaching them to love their bodies, love themselves, provided with societal family support, family support services, not mutilation and drugs. I'll just remind the public that I'm also an experienced and qualified teacher for nearly 30 years. So I'm an expert on these issues. And particularly as a physical education teacher and health education teacher, I give expert advice about this and many, many other issues. Most of the gender, transgender, gender reassignment, gender affirmation, gender confirming surgeries for both male and female include facial gender surgeries, body sculpting, body feminization, masculinization surgeries, liposuction, hair transplanting for biological women, trans-masculine surgeries, phalloplasty, classified as bottom surgery along with some others, penile rectal implants, scrotoplasty, glandsplasty, urethroplasty, ovarectomy, which includes oophorectomy, removal of ovaries, bilateral salpingo oophorectomy, removal of both fallopian tubes. I tell you, with the research and when I documented and wrote all this, I just about pretty much become a doctor at learning all about these horrific surgeries. Mediodiaplasty, Mons resection, gender hysterectomy, gender vaginectomy, gender perineoplasty, top surgery, which is cutting off healthy girls' and women's breasts, bilateral mastectomy with chest reconstruction, chest masculinization surgery, subcutaneous mastectomy, there's other medical terms for that. For biological men, transfeminization surgeries, orchiectomy, scrotorectomy, penile inversion, penectomy, labiaplasty, clitoroplasty, vaginoplasty, vulvoplasty, zero-depth vaginoplasty, genital nullification, chondrolaryngoplasty, tracheal shave, reduces thyroid cartridge, the Adam's apple size, reconstructive urology, urethroplasty, buttock augmentation, breast implementation, enhancement, breast augmentation, facial feminization. It's outrageous. The public is paying for this through every nation's political tax system, including the training and practice of surgeons, other medical staff, tests, equipment, patient pre- and post-op operative services, recovery, other lifelong associated health and other service economic costs, government societal services. It's trillions of dollars globally. Furthermore, how can anyone expect to have normal sexual pleasure and reproductive function after such risky, complex surgeries, drugs? It's beyond comprehension. It's rarely possible. All for a lie in the brain and the heart. It's not a question of can surgeons do this, it's a question of morally should surgeons do this. Surgically, what I learned was what they can do is actually quite incredible, but it's just not worth it. It's not healthy. So I described in my book, chapter 6, a lot of these surgeries. I went through all the medical aspects and the wound healing, and which proves it's a wound. They're creating a wound, and what the patient goes through. What the patient goes through, and what the surgeries do. I mean, I just imagine being a surgeon, getting up, doing a job like this. You're just mutilating the human body. changing it, some sort of sick, perverted experimentation. It should be outlawed. Those gender surgeons in a couple of years in prison, that's my view. And getting paid a lot of money, and the politicians are paying for it. You know, they put it in the law and they force the judges and to enforce it and all this shocking stuff. So, what do you want to hear about? The details of a phalloplasty, the creation of a fake penis, phallus and scrotal sac, and fake testicular implants in the scrotum and implants for erection. That's the phalloplasty. I've got through 3 pages of it. And then you've got all these. What about if I describe for you a vaginectomy? That's a hysterectomy for the transgender man, which is a biological woman. Okay, which one should I describe for you? There's heaps of them. What about a vaginectomy? A vaginoplasty. That's where a man will take his penis and have it inverted and they'd create a fake vagina. You want me to read that one? I've got heaps of them. I think I'll just read that one. Top surgery. You know, the top surgery, which is the bilateral mastectomy of women and girls, that's the most common gender surgery. Do you know that globally? Is when they cut off the girl's breasts, which is a massive attack on women and girls globally. And also, the gender surgeons in Australia, there's 35 of them, but I named them all in my book. 85% of them are men. 85% of them are men, and they're cutting off girls' breasts as the most common gender surgery. All right, I think I'll read out the. Just buy my book and you can read all these surgeries for yourself. I'll read this one. 5 different vaginoplasty surgery methods include penile inversion, intestinal sigmoid, peritoneal revision, zero depth, which is vulvoplasty. It's not as they don't go as deep. Vaginoplasty surgically constructs and reconstructs a fake vagina. It requires removing the penis, it's called a penectomy, testicles, orchiectomy, and scrotectomy. Genital tissue used to create the vagina, fake vagina, involves surgically rearranging tissue in the genital area to create a fake vaginal canal opening of 4 to 6 inches deep, and fake vulva, external genitalia, including the labia. To create the fake vaginal canal, the surgeon uses a combination of the skin surrounding the penis along with the scrotal skin. Depending on the quality of the skin available in the genital area, the surgeon may need to use skin grafts from the abdomen or thigh to construct a fake full vaginal canal. Vaginoplasty is a one-stage procedure of 7 to 10 hours. Sometimes the testicles are removed, orchiectomy, beforehand, but this is not required. An orchiectomy before vaginoplasty increases the need for skin grafts. Permanent hair removal is required 3 to 6 months before the procedure. Patient stays in hospital for 5 to 7 days recovering. A catheter in the urethra is removed before discharge, and a further 6 to 8 weeks recovery at home. 8 days after surgery, non-centered douching, cleansing the fake vaginal canal. They call it douching. Douching is required daily. Cleaning with soap and water. Keep the area dry and clean. Never scrub or allow water to be directly sprayed to the surgical site. The surgical and medical literature describes it as wound healing. Vaginal discharge occurs, requiring an absorption pad, and urinating spray commonly occurs. Sensation is not guaranteed after vaginoplasty. Sexual activity is not permitted for 12 weeks or to facilitate wound healing. Nerve function can return after 3 weeks. Dilation is required twice daily for 15 minutes each during the first few weeks after surgery to prevent losing vaginal depth and width. Dilation involves inserting a medical-grade dilator into the fake vaginal canal opening to keep it open. As the wound area heals, they come in different sizes. It can be painful and lubricant is used. Patients continue to use a dilator for as long as the care team commends. Some patients may need to dilate their entire lives. Patients often experience complications with vaginoplasty, including narrowing of the fake vaginal canal, known as stenosis, a fistula, an abnormal connection between the new vagina and the rectum, urethra, or bladder. Such complications are treated with additional surgeries, and additional surgeries may require to revise the appearance of the vagina and vulva. That's the source from John Hopkins Medicine, Vaginoplasty for Gender Information. And I've written there, the fact they use a dilator proves it's a human-created wound. The body's natural biological response is to repair and close it up. Notice gender surgeons use the term wound healing when legitimate medicine is defined by healing or fixing a body part that is already broken. The surgeon and patient created the wound. Is it worth it from a lie in the brain and heart? And the economic cost of the public? ? Gender surgery should be outlawed. I've used the word fake as it is. It's not biologically natural. Imagine doing this for a job. And then there's other sources here, vaginoplasty procedures, complications and aftercare. The most common vaginoplasty technique is some variation of the penile inversion procedure. A fake vaginal vault is created between the rectum and the urethra in the same location as the non-transgender female, which is a woman, adult human female, between the pelvic floor Kegel muscles and the vaginal lining to create from penile skin. An orgectomy is performed. The labia majora are created using scrotal skin, and the clitoris is created from a portion of the glans penis. This is clitoroplasty. The prostrate is left in place to avoid complications such as incontinence and urethral strictures, and for erogenous sensation. Great care is taken to limit external scars by locating the incisions appropriately and with meticulous closure. Typical depth is 15 centimetres, 6 inches, with a range of 12 to 16 centimetres, 5 to 6.5 inches, compared with typical vaginal depth in non-transgender females, which is real women, real biological women, of 9 to 12 centimetres, 3.5 to 5 inches. So with this vaginoplasty, they actually make it deeper, which is very weird. It's probably because the male pelvic area is a bit larger. I've put there, inserted my view, probably several reasons for larger depth. Men don't have a cervix and uterus. They don't have a cervix and a uterus, so, it has to be a greater depth. In case of prior circumcision, a skin graft, typically scrotal in origin, may be required. If there is insufficient skin between the penis and scrotum to achieve 12 centimetres, 5 inches of depth, a skin graft from the hip, lower abdomen or inner thigh is used. Resultant scarring at the donor site may be minimised or hidden using standard techniques. Because the penile inversion approach does not create a vaginal mucosa, the fake vagina does not self-lubricate and requires the use of an external lubricant for dilation or penetrative sex. Scrotal skin has abundant hair follicles, and it's impossible to transfer skin with sparse hair growth into the vagina unless hair is removed in advance. Some surgeons rely on treating all the visible hair with aggressive thinning of the skin and cauterization of visible hair follicles at the time of surgery. However, since the hair grows in stages, this approach might not likely address dormant follicles. The most reliable method of preventing hair growth in the vagina is to perform scrotal electrolysis. I just insert the word fake there. The medical literature just calls it a vagina. This is all medical sources. Perform scrotal electrolysis at least 3 full clearings, 8 to 12 weeks apart. Electrologist preference, hair type and distribution. A common outcome of penile inversion of vaginoplasty performed in a single stage with penile skin positioned between scrotal skin is labia majora that are spaced too far apart. There may also be minimal, if any, clitoral hooding, except in heavier patients, and a labia minora may be insufficient after one operation. This constraint is due to factors inherent to the penile inversion approach and the limitations of the blood supply. A second labiaplasty is sometimes recommended to bring the labia majora to the midline in a more anatomical correct position, provide adequate clitoral hooding and define the labia minora. Many variables affect healing and the final result. A secondary procedure allows the surgeon to deal with differences in healing, such as revision of the urethra, correction of any vaginal webbing, or persistent asymmetries, revise unsatisfactory scars, improving functionality and appearance. Immediate and long-term post-operative considerations: gauze packing, or a stenting device is placed in the vagina intraoperatively and remains in place for 5 to 7 days. Urinal catheter and drains in place. Care for bowel movements. Once removed, the patient is instructed in vaginal dilation provided by surgeons. Schedules vary between surgeons. Ensure the dilator is clean. Use antibacterial soap and water. Apply water-based lubricant, not silicone-based, to dilator before insertion. Insert dilator into full depth of vaginal canal, fake vaginal canal. Stop if too much resistance or pain. 4 coloured dilators are used, increasing in diameter size. The first for 0 to 3 months, 3 times a day for 10 minutes each time. 3 times a day for 10 minutes each time for the first 3 months. That's the violet one, 1 to 1/8 inch. The second for 3 to 6 months, 1 time a day for 10 minutes, once a day for 10 minutes. The third for 6 to 9 months, 2 to 3 times a week for 10 minutes. That's the green dilator, 1 to 3/8 inch. The fourth for 9 to 12 months, 1 to 2 times a week for 10 minutes. That's the orange dilator, 1 to 1.5 inches. If vagina feels tight, increase frequency of dilation schedule. There's dilating so that keep it open so that it doesn't close up, because it's a wound. The surgeon created a wound. The patient created a wound. And the body's natural biological response is to close that wound up, close the wound up, and it's constantly trying to close up. That's the human body. It thinks it's a wound. It knows it's a wound. And then this dilator has to keep it open, and they have to do it every day, and just sometimes they have to do it forever. It's just terrible. Okay, where did I get up to? Use soap and water to cleanse the vaginal canal after each dilation. Avoid strenuous activity for weeks to 3 months. Sitting will be uncomfortable for the first month. Resume showering following the first post-operative visit. Pat incisional areas dry. No baths or water submergent for 2 months post-op. Do the politicians actually read this medical literature when they put this shit in the law? Jesus Christ. Sorry for blaspheming Jesus. But it's just... And the billions and billions being wasted on this, it's just horrific. No baths or water submergence for 2 months post-op. Resume showering following first post-operative visit. Pat incisional areas dry. Labial swelling is normal for 6 to 8 weeks post-op. For the first week, apply ice to the perineum for 20 minutes every hour. Sexual intercourse is permitted 3 months after surgery unless otherwise instructed. Wash hands before and after any contact with genital area. Shower wash daily. Wipe front to back. Avoid tight clothing. Brownish yellow vaginal discharge is expected 4 to 6 weeks post-op. Oh, that's just pretty much blood. Bleeding and spotting is expected for 8 weeks post-op. Use soap and water douse chamomile or lavender liquid soap or to cleanse neo-vagina. No smoking 1 month after post-op, because smoking kills the body. start with liquid diet and increase to normal. Pain drugs can be prescribed. Immediate risks include bleeding, infection, numbness, skin or clitoral necrosis, suture line dehiscence, urinary retention, vaginal prolapse stenosis, fistulas from the rectum, urethra or bladder usually present early on. Acute bleeding usually originates from the urethra, usually controlled with local pressure. If no hemostasis achieved, placing a larger catheter, 20F, in the urethra may stop bleeding. A suture around the bleeding site may be required. Localized hematomas is to spontaneously drain through the vagina or suture line is relatively common, occurring more than a week after surgery as the hematomas liquefy. The blood appears dark and old. It's not accompanied by clots. Although frightening to the patient, no treatment is indicated. The genitalia and perineum have an excellent blood supply, so infections, skin loss or separation should be rare and seldom require more than a broad-spectrum antibiotic. Separation of the suture line can occur most often at the posterior perineum, the sensitive skin between the genitals and the anus, due to dilation, pressure and stretching. Dilation is critical and should not be discontinued. Failure to adequately dilate will likely result in severe vaginal stenosis, narrows, shortens, restricts, closes up. No attempt at immediate secondary closure of the dehiscence, separation of wound edges is indicated since it's a contaminated wound. This is the medical literature admitting that it's a contaminated wound and will likely fail. Dehiscence may result in the development of a posterior web. It creates a web. So it's trying to heal itself, you know what I mean? And, this can be revised at a later stage. Partial or complete clitoral necrosis, dead tissue, may occur and can be treated with antibacterial ointments. In most cases, the neurovascular bundle and portion of the clitoris is still present and will usually maintain a good sensitivity. Yet it's not natural, is it? That's what I inserted. Urinary retention due to swelling and or neuropraxia, temporary peripheral nerve injury, should be treated with catheter replacement for 5 to 7 days. Early strictures are rare. Excessive skin grafting may result in expulsion of a portion of the add skin graft through the vagina 2 weeks after surgery. A more severe scenario is expulsion of the entire vaginal skin lining with some bleeding. Not common, it's a disastrous complication requiring surgical intervention, typically 1 year later, to realign the vagina. Regardless of complications, adherence to the dilation regime is critical to healing and maintaining vaginal depth and girth. Must continue regularly for more than 1 year post-op. The dilation schedule is increased if regular patient and in-house examination shows a diminishing vaginal depth or width. Lubricants and vaginal antifungals can be applied to dilation device or syringe into cavity to alleviate pain. Possible causes of pain or inadequate dilation include a small pelvic inlet, muscle spasm, and vaginismus. Remedies include botulinum toxic injections, removal of webbing at vaginal entry, and or refer to a physical therapist. The fake vagina skin line under normal conditions is colonized with a combination of skin flora as well as some vaginal species. A study of vaginal flora isn't in a mixture. I mean, I just have a natural vagina, right? All women in this world have this is just bullshit. They just create all this medically. It's just, frightening. A study of vaginal flora in a mix of transgender women, biological men, with and without symptoms of odour and discharge found Staphylococcus. These are, vaginal flora. Staphylococcus, Streptococcus, Enterococcus, Corynebacterium, Mobiluncus, and bacteroid species to be most common. The lack of a mucus or low pH are consistent with the study's finding of rare lactobacilli and no candida, sometimes found in biological women. Discharge is most likely due to sebum, dead skin, keratin, debris, retained semen, or lubricant. Since the vagina does not contain a mucosa, routine cleaning or dousing with soapy water should be adequate to maintain hygiene. A yearly visual pelvic exam to screen for lesions, granulation, tissue, or undesired loss of depth and girth is reasonable. Look at that, they're wasting billions on this. Since the vagina is skin-lined, a risk of developing the same skin cancers that occur on penile and scrotal skin, squamous cell, basal cell, and melanoma, and psoriasis exists. Prostate exam performed endovaginally, and the rectum approach may be obstructed by the new vaginal walls in the prostate. A far less common approach to vaginoplasty is the use of either the colon or small bowel to line the vaginal vault. There are a few advantages and a long list of complications. Fistulas. The most common is a recto-vaginal fistula, almost universally the result of surgical injury to the rectum. Small fistulas may only pass flatus, while larger fistulas can allow stool to drain through the vagina. A temporary diverting colostomy may be required for hygiene. Dilation must continue to avoid closure of the vagina. The fistula to be repaired in 6 months. Just continue that dilation. Urethrovaginal fistulas present with urine leakage from the vagina. Fistulas become between the bladder and the vagina are the least common, yet the most difficult to manage. A Foley catheter in the bladder will divert a majority, but not all of the urine. Surgical intervention will be required. Granulation tissue in the vagina is the result of delayed healing and is common. The necessary frequent dilation exacerbates the problem by causing repeated trauma to the granulation area. The typical complaint is of mildly blood-streaked yellowish discharge. It usually heals over time if persistent regular silver nitrate and topical treatments of steroid cream or medical-grade honey will speed the healing. Silver nitrate can be applied to granulation areas until cautery is observed with resultant grey scabbing and coagulation. Steroid creams and honey is applied to the dilated tip. Long term, the penile skin-lined vagina should be very durable. Urinary tract infections are common since the urethra is shortened during vaginoplasty. Proper hygiene and hydration are generally adequate preventative measures. Recurrent urinary tract infections are evaluated for urethral stricture. And on and on and on and on and on and on and on. And all the other surgeries I just went through in the same detail. And no one's ever written a book like this, trust me, on that. Another part I highlighted here for this chapter to read out to you. How are we going for time? Probably, probably going to be a bit longer, this video. There's a lot of evidence here, a lot of evidence in chapter 6 of my excellent book. A very strange and sinister practice resulting from gender trans ideology is the practice of biological men chest-feeding babies. It's a massive attack on women, mothers and babies. Outrageously, it's promoted by many political, government-funded university, medical, hospital, disease control, as well as shockingly national and international breastfeeding organisations, such as the Lactation Network, Australian Breastfeeding Association, Academy of Breastfeeding Medicine, the International Breastfeeding Journal, La Leche League International, the International Breastfeeding Centre. The UK Breastfeeding Network does not specifically advocate for men chest feeding, yet has an article regarding the importance of supporting breastfeeding and LGBTQI plus families. They estimate 1 to 10% of the population is LGBTQ+, and 10% of LGBTQ+ have children. They and some other... Well, it's only 10% of the population then is LGBTQ+, and only 10% of those have children, but they ram this down society's throat with billions of dollars in the schools and society, and that's not fair on the general... It's not fair on the majority, is it? I talked about that in my book as well. Because 90% of the world's Australian population and the world's population generally is heterosexual. You know, man and a woman have babies, so they ram this down society, just so criminally. That's the politicians again. I'm blaming the politicians. They and some other breastfeeding organisations do support the use of the prolactin-inducing drug domperidone, brand name Motilium, for breastfeeding women, a big no-no as it's a nasty drug, citing a 2014 European review, yet ignoring its subsequent clinical study and banning in children's use, also citing Canadian sources. Remarkably, in 2024, the WHO, UNICEF, a global organisation, remarkably, Global Breastfeeding Collective, uses only the words women, mothers, maternal, maternity, breastfeeding, newborn, not any transgender, gender, male language and reference. Outrageously, a little town called Borough, it's quite a busy little town. Outrageously, a UK NHS Sussex Trust USHT erroneously claimed trans women, biological men, artificial drug-induced chest milk is as good for babies, comparable as breast milk produced by mothers who've given birth. That's an outrageous claim, isn't it? According to many published sources, the leaked letter from the Trust's medical director also referenced a 2022 study that found milk testosterone concentrations in biological women taking testosterone for trans purposes were under 1% with no observable side effects in the babies. I tried to find this study. It does not exist on the internet. So the claim is invariably false. Another false claim I found in the NCBI published research on domperidone. Domperidone is a nasty drug, chest feeding drug. Induces chest feeding. It's banned in the United States. Another false claim I found, the NCBI published research on domperidone, one of their trans women, male, biological man, chest feeding study, claims 6 months feeding. When I checked the original study, it blatantly states 6 weeks feeding, not 6 months. So if you see a study, especially on this area, some sort of medical study, you've got to actually check whether it's real or not. I checked it and it wasn't real. It claims 6 months, but the original study is actually 6 weeks. USHT has since removed the original guideline from its website and replaced it with links to La Leche League breastfeeding. Significant and numerous widespread short and long-term studies prove when biological women breastfeed, many health benefits result for the baby and mother. It significantly increases baby nutrition. This is mothers, real biological women. It significantly increases baby nutrition, reduces the risk of infectious diseases in babies, reduces infant mortality, brings lifelong benefits such as better cognitive development in children, benefits the mother's health, such as decreases the risk of breast and ovarian cancer, other health benefits for both baby and mother. It also enhances the emotional bond between mother and baby. My mother breastfed all 9 of us children. My parents were married for 53 years until their death. My mother breastfed all nine of us. Very limited studies on men chest feeding are biased, exclusively individual subjects, only 3 individuals. Not widespread, very limited in number. The only study of its kind, a January to February 2022 Chinese cross-sectional study of 647 transgender and gender diverse patients, both biological women and men. Study doesn't specify sex proportions. Showed the exclusive breast chest feeding rate was only 33.5%. It's 214 breastfed. Only 41.3%, 244 of infants could be continually fed until 6 months old. So only 41.3%, which was 244 people in the study of infants could be continually fed until 6 months old. Accepting hormone therapy after childbirth, receiving feeding education were associated with higher exclusive breast chest feeding rates, were more likely to feed their child human milk as the first food intake. Having received hormonotherapy before having a child, high gender dysphoria levels, experiencing family partner violence, having a child with artificial insemination and surrogacy, no feeding education, experiencing discrimination during health seeking, lower exclusive chest feeding rate, less likely to give their child human milk as first food intake, a shorter breast chest feeding duration, are all associated with poor breast chest feeding practices in transgender diverse parents. All of these breast chest feeding factors also were lower in transgender diverse parents comparative with what they call the cisgender population, which is just like, insulting the normal people. Study NLM sources stated in next paragraph. There's an article I quoted, the ugly truth of male breastfeeding, 8th of July 2023, Nalia Nava. She has a BA in medical anthropology and cognitive psychology. She includes 17 additional medical research sites in her analysis, criticises the validity and efficacy claimed of published individual trans women biological men studies, proving low and inadequate milk production volume, inadequate nutrition, negative hormonal drug effects and levels, concludes there is no sufficient evidence proving men can safely and effectively breastfeed infants. The Paradox Institute source. Not only is it not safe, it's dangerous for the baby and the adult. For men to lactate, they take drugs. Progesterone, estrogen, domperidone, breast pumping, they can't lactate without them. Good evidence for the safe use of pharmaceutical galactagogues is seriously lacking. Domperidone is prescribed off-label as a galactagogue to increase the secretion of prolactin, the hormone required to produce breast milk lactation. They give it to women as well as aid breastfeeding without much additional benefit, yet it's a nasty, dangerous drug. Remarkably, domperidone is not legally approved in any nation to stimulate lactation or enhance breast milk production in women nor men. It's prescribed for this purpose off-label. It's legally prescribed in some nations to treat nausea, vomiting, and gastrointestinal disorders. Domperidone is banned outright for any use in the United States since 2004. Not approved for human use in the USA, the FDA is aware people have used domperidone to stimulate lactation or enhance breast milk production. The effectiveness of the drug to stimulate lactation or increase milk supply has not been established. Domperidone is associated with serious cardiac adverse events, including cardiac arrhythmias, irregular heartbeat, serious ventricular arrhythmias, FAMHP, cardiac arrest, and sudden death. FDA has indicated cases of serious cardiac adverse events with domperidone using in lactating individuals, specifically QT prolongation, heart rhythm disorder, torsade de pointes, polymorphic ventricular tachycardia, cardiac arrest, and sudden death. In 2004 and again in 2012, FDA published a warning about cardiac-related risks with the use of domperidone to increase lactation. In response to reports women may be using an unapproved drug, domperidone, to increase milk production, lactation, the FDA is warning breastfeeding women not to use this product because it's of safety concerns. FDA also issued 6 letters to companies and pharmacies that supply or compound products containing domperidone and issued import alerts. FDA took these actions after it became aware some women who breastfeed and or pump milk are purchasing this drug, domperidone, from compounding pharmacies and sources in foreign countries to increase breast milk production. Domperidone may increase the secretion of prolactin, a hormone needed for lactation. In 2023, FDA completed a review of cases to evaluate neuropsychiatric adverse events associated with the discontinuation or attempted discontinuation slow dose reduction of domperidone when used for lactation. They found evidence of agitation, anxiety, attempted suicide and ideation, confusion, insomnia, intrusive thoughts, homicidal ideation, obsession thoughts. Well, that's psychiatric and pharmaceutical drugs for you, isn't it? When taken by a lactating individual, domperidone is excreted in breast milk and could expose a breastfeeding infant to unknown risks. FDA cautions that use of domperidone to increase milk production or stimulate lactation could cause serious adverse effects. That's directly from the FDA. Domperidone, also known as motileum, manufacturer Janssen, has a black box warning on its patient leaflet. Small amounts have been detected in breast milk. Motileum may cause unwanted side effects affecting the heart in a breastfed baby. Should be used during breastfeeding only if your physician considers this clearly necessary. And from the 11th of April 2019, the Federal Agency for Medicines and Health Products, FAMHP, located in Brussels, banned, no longer approved, banned the use of domperidone in newborns, infants, children under 12 years and adolescents weighing less than 35 kilograms at European level. It referenced a clinical study for use in children post the 2014 European review. It demonstrated a lack of efficacy of domperidone, no benefits compared to a placebo, and a cardiotoxicity risk in pediatric child doses. The study was terminated early, and Motileum, the marketing authorization holder, offered to remove domperidone in those children categories. His proposal was approved by FAMHP and the other European member states concerned, effective the 15th of September 2019, removal from the market. Large database retrospective cohort studies in Canada found with domperidone an increase in the risk of cardiac arrhythmias and sudden cardiac death. Maternal side effects of domperidone reported in galactagogue studies, cases and surveys reported to the FDA include muscle jerking, dry mouth, headache, dizziness, nausea, abdominal cramping, diarrhea, palpitations, malaise, shortness of breath, irritability, breast engorgement, weight gain, fatigue. Drug withdrawal symptoms include tachycardia, severe psychomotor agitation, severe insomnia, severe anxiety, cognitive problems, palpitations, hot flashes, vomiting, headaches, depression, suicidality, and more. Lower doses reduce milk supply. Testing of breast milk samples of mothers with domperidone intake 10 milligrams to 40 milligrams 3 to 4 times a day detected 0.28 mcg per litre to 8.4 mcg per litre concentration in the breast milk samples. Limited studies and reports on effects of domperidone in breastfed infants very report no side effects, no serious side effects, non-serious side effects, serious adverse effects, unknown risks detected in breast milk may affect baby's heart, banned outright in the USA, banned for newborns, infants, children under 12 years, adolescents weighing less than 35 kilograms in Europe. Sources: ibconline.ca, illi.org/breastfeeding, breastfeeding.asn.au, excuse me, lactationnetwork.com, abm.memberclicks.net, breastfeedingnetwork.org.uk. International Breastfeeding Journal.biomedicalcentral.com. Trans women's milk as good as breast milk, says NHS Trust Telegraph.co.uk. Rates of breastfeeding or chest feeding influencing factors among transgender and gender diverse parents, February 2023. This is all the sources. TheLancet.com, March 2023, NLM, PubMed Central, ncbi.nlm.nih.gov, The Ugly Truth of Male Breastfeeding, theparadoxinstitute.com, domperidone, Drugs and Lactation Database, ncbi.nlm.nih.gov, 2024, FDA information about domperidone, and FDA warns against women using unapproved drug domperidone to increase milk production, fda.gov. Domperidone no longer approved for use in children due to lack of efficacy, 2019, famhp.be. So, for these biological men to lactate, they have to have this drug and other drugs like estrogen and progesterone, and it's just a deadly drug. So it's just horrific for the man and the baby too. It's just criminal. So there you have. That's all the medical evidence on that horrific drug, and the we know that biological women breastfeed, and that's natural and normal. Impact on society. Just a few words. I've got heaps in this chapter. I'm not going to get just reading extracts out. Having concern for LGBTQI people and its impact on society is not bigotry, homophobia, transphobia, or queerphobia. When the medical and health evidence is clear, it's not a positive lifestyle to choose or pursue. So when politicians and their paid workers, organisations, corporations, activists of all kinds force their LGBTQI plus indoctrination on children, parents, schools, and society, everyone should be very concerned of the personal health and societal impacts of that, especially on children. Often this forced nature is threatening and violent when parents, professionals and others object or don't support the indoctrination and don't want it, like also creating laws that'll lock you up for 5 years in a prison just for talking about issues. They should be jailed themselves for 5 years, those politicians doing that. Children belong to their parents. They don't belong to the state, and certainly not to the LGBTQI plus community when they're going after other people's children. It's grooming, and much is publicly said about the often fetish, predatory, pervert, narcissistic, misogynist, autogynephilic, pedophilic, internalised homophobia, nature of the LGBTQ plus agenda, especially the QT. That's not to say everyone in that community, because there are many, many gay people and trans people against it being forced on society and the schools and the health system and the tax system and the law and the courts and everything. That's not to say everyone in that community, because there are many gay and trans people against it. They don't identify with that community nor support what they're doing to children and society. The LGBTQI plus agenda generally don't want people to be heterosexual and procreate, have children, proving it's eugenics, depopulation. Because when they force that on society, they don't want you to have children naturally. So society will have less children if they keep forcing this on society. They want everyone to be, quote, gay, queer or trans. That's what they seem to want by putting it in the law and forcing it in the schools and the hospital system. And people that speak out against it lose their jobs and all this sort of shocking stuff, or say something. Like not use the particular pronoun and all this sort of stuff. Okay, there's a lot more to that section as well. Impact on society. I have got a lot of information about that and how and how God and Jesus loves all humans as well. Like my hat. God and Jesus loves all humans, regardless how you identify. But the point that I made in the book, and that is, it shouldn't be forced on society in the law and public spending and government workers. Okay, there's a lot more about that topic, impact on society, but I'm going to just, this video is going to be quite long. I'll just read out as an article, it's probably going to be about 2 hours, this video, I guess. Population control. This article, which I put in my book, is written by a biological man who identifies as transgender. Very interesting analysis published by trans-identified biological man Autumn Asphodel in May 2018 called The Transgender Population Control Agenda. Gives a very good insight into the government eugenics nature of gender ideology. This is quoted him, I'm quoting him now. Is the transgender movement really about equal rights, or is there something much deeper under the surface? This is what he writes. The transgender agenda is used to indoctrinate children into a gender-confused society that is filled with corruption and laws to silence the public by using minorities as a deterrent. This is his view. LGBTQI plus may be a form of natural population control via overpopulation, and man-made population control via the vast amounts of endocrine disrupting chemicals we are exposed to daily. Those in the LGBTQI plus community, referred to as lesbian, gay, bisexual, transgender and all other varieties of gender and sexual orientation, have become the centre of many activist movements and laws. On the surface, activism and the laws supposedly made to protect those in the LGBTQI plus community seem plausible and the way forward. But underneath there is a bed of corruption driven by political power and money. By today's standards, the very act of questioning why someone is gay or transgender has been deemed as hate speech and an act of violence due to the sensitivity of those in the LGBTQI+ community and the topic in general. This man wrote this back in May 2018, 7 years ago. Many activists demand for rights they feel they're entitled to, yet they are essentially putting their own agenda before that of their community, as well as limiting the freedom of speech and expression of everyone who disagrees with them. The mindset many activists have that they are right and anyone who opposes or disagrees is wrong. No other opinions exist. Activists are nothing more than pawns of the corrupt political powers that control this world. To begin an activist movement that is pro-LGBTQI+, you'll get a lot of attention and funding. My battery is going flat everywhere. Phone, speaker. Get a lot of attention and funding to drive your message into the mainstream. This funding comes from government entities that wish to have a bigger say in the rights of the human population as a whole. Controlling an entire population starts with controlling those who are the minority. The minority then demands for rights and special privileges to silence all opposing voices. Questioning these motives. Oh no, my battery's going flat. Okay, my battery's all going flat. Okay, I'm gonna have to do. I think I'm gonna have to do.
The Bluetooth device is ready to pair. The Bluetooth device is connected successfully.
Okay. I think I'm going to have to do a part 2 for this chapter.
Power off.
What I'm going to do is I'm going to do a part 2. Oh, hang on a minute. I like to keep it in the same video, you know. I've got another microphone on order as well. That battery's gone flat. It's supposed to last for 5 hours. It's supposed to last 5 hours, that speaker. Anyway. Okay, this article is really, really important, and I want to finish this article. I just think I'll just keep going, but I think my phone battery is going to go flat in a minute. So if I get cut off, I'll just do a part 2 for this chapter. So to begin an activist movement that is pro-LGBTQI+, you'll get a lot of attention and funding to drive your message into the mainstream. This funding comes from government entities that wish to have a bigger say in the rights of the human population as a whole. Controlling an entire population starts with controlling those who are in minority. The minority then demands for rights and special privileges to silence all opposing voices. Questioning these motives or speaking out against them would be considered discrimination, thus specific rules are made to control the rest of the population and robbing them of their own thoughts and free speech. An example of this is the inability to call pregnant women expectant mothers, as that would offend those that are intersex and transgender men. Some laws have gone so far as to specifically target children who claim to be transgender. Specific laws are made to protect those few individuals. And one proposal is for letting children as young as 5 years old choose their own gender and race without parental consent. The transgender youth are rare, and making specific laws to shield them from the world is not only harmful to the child but also to the parents. with laws essentially promoting the transition of youth, even medical transition by puberty blockers. It only makes the child who is confused even more so, without the ability to grow and learn until they are of legal age to do as they please to their bodies. Exposing children to the sexualized LGBTQ plus agenda before they hit puberty and can understand their sexuality confuses and brainwashes them and pushes the transgender to sexualize children. Pushes the transgender agenda to sexualize children. The transgender agenda is used to indoctrinate children into the cult, to exploit and sexualize them. We see the sexualization of LGBTQ plus via sexualized pride parades, especially those that children attend, and even the media glamorization and promotion of the youngest drag queen who gained popularity when they were under 10 years of age. This agenda is also about demanding for equality and being better than everyone else over true equality. Feeding off oppression, the act of playing the victim is extremely high. Activists tend to be brainwashed to push the agenda. Many activists claim to be born this way. The act of born this way simply doesn't exist. There is always a reason why something exists in the world. But many of these same activists say questioning how someone is transgender is considered discrimination. Some activists even say it's the way forward, evolution of the human species. There are a variety of reasons that can contribute to being transgender, some of which has to do with a form of population control. Since the population has far exceeded what is comfortable in the environment we live in, natural limits on the population by a natural form of population control. That's really how the globalists think and the politicians think, isn't it? They think there's too many people in the world, so they just want to eradicate people. Since gay and transgender people cannot reproduce, this is what he says, this man says, they are essential at keeping the population at a manageable size in our ever crowded world. I inserted there, I dispute this as natural because it's man created. We must also not forget the man-made population control via synthetic endocrine disrupting chemicals. With the increase of these toxic chemicals in our environment that we are exposed to even while in utero, it impacts our endocrine system, our hormones, and leads us to have an imbalance of such hormones and various disorders, or subjectively labelled disorders. They're not really disorders. Transgender people are often believed to have been born in the wrong body, meaning that while in utero, hormonal changes made the developing brain and body incongruent and not all male and not all female. Due to endocrine disrupting chemicals in our environment today, from plastics in cans, baby formula, medications, even the very food and water we drink, we are bombarded with chemicals that even in minute amounts disrupt our hormones and overall health. Some of these chemicals are BPA in plastics and cans, various pesticides like the most commonly used one, glyphosate, is that how you say that, glyphosate, which can be in many conventional foods and in the water supply, and even some food products that contain plant estrogens, also known as phytoestrogens, or plant-derived exoestrogens, such as soy. There is a specific reason why the number of those who identify as transgender, non-binary, and other various genders have been increasing. Some say more people are LGBTQI+ because it's easier and more accepting to come out and get treatment these days. You know, this sort of treatment. Yeah. Surely that is a component, but there is a great deal missing from this assumption. One hypothesis is this form of population control by natural and man-made means, but the other being due to social exposure. Children exposed to transgender things before they are able to understand their own gender and sexuality results in confusion within that child. Also, let's not forget all the attention and exposure trans youth receive, further increasing the chances that a child who wants attention, who perhaps feels neglected, will identify differently to get attention. Parents are then forced to comply with their child's demands. Some parents even promoting and glamorizing their child for publicity and money. Let's not forget the hormones and procedures used to treat transgender individuals are dangerous, unnatural, and don't always solve the problem. Taking hormones and getting surgeries to alter the characteristic that defines an individual is risky and severely impacts one's mental health, which is just brain health. There's no such thing as mental health because every human has a brain. But anyway, I covered that in chapter 5, which is one reason why there are high suicide rates in the transgender community. Bullying and lack of acceptance makes up a large part of suicide.